I graduated from medical school in 1982. Then I did my army like all good Singaporeans, and subsequently, I went to specialize in internal medicine. I had my postgraduate degree, Master of Medicine in Internal Medicine, and then subsequently was admitted as a member of the Royal College of Physicians in UK. I was awarded the Professor Sir Gordon Arthur Ransome Gold Medal. And so, I really had a full range of choices as to what I wanted to specialize in. It is indeed very gratifying for me to see that this is a field which has really exploded in terms of developments, in terms of being able to have so many more treatments for cancer patients, improving the lives of cancer patients, and seeing this field take off with so many people interested in really caring for cancer patients. I feel that I've been rewarded. The first really is in terms of seeing how patients have benefited from what oncologists can offer. To see the advances that we have made in cancer management, to see what we can offer our patients, that regional patients, they've come to Singapore to seek medical care for treatment of their cancers. That to me is truly something that we can be very proud of as a community. The sad truth is that the large majority of patients who present with stage 4 disease are not cured of their cancers. While we are often able to kill the cancer cells, shrink the tumors down, control the disease, improve quality of life, and prolong lives, for many of these patients with stage 4 disease, we don't cure them, while it becomes a chronic illness which we have to handle and deal with. I look forward to the day when indeed, we have reached that stage whereby despite having stage 4 disease, we can still cure the patients. There's no greater joy than to see a patient come in with a debilitating disease, wheelchair bound, and after treatment a few cycles, you see the patient walk into the room feeling better, being able to enjoy time with the family. That is a good day, to see a patient do well. My highs and my lows are dependent on how my patients do. When they do well, I feel I've done something for them, I've achieved something, and to help them improve their quality of lives or to cure patients, then I feel it's a good day. But a bad day is one where I have to face the disappointment of poor results. I think that, it is a misconception to believe that oncology is a depressing field, because truly it's not. Partly maybe because of my personality. I'm a very enthusiastic, positive, optimistic kind of a person. So when I look at what I do, I feel very fired up and ready to do my best for my patients. I have a never say die attitude. And that perhaps is one of my strengths in why, so many patients come to see me. Each time a patient comes in, I greet them with enthusiasm and I encourage them in their fight. So to me, it's not a depressing field. It is something whereby we have come a long way, and I believe that each time we help a patient get better, that is like an encouragement for me to just push on and fight on behalf of our patients. To me, this is what medicine is all about. It's really to be able to make a difference. If I can make a difference in one person's life, I think that already to me is a great joy. But for me to be able to help so many to have come to seek treatment, whether to cure their cancers or to prolong life, I think that there's nothing depressing about oncology. It's a very exciting area. It's an area which I encourage young doctors to consider pursuing. I always believe that when you're stricken with cancer, it takes a little bit of getting used to. It's depressing, there's denial and so on. But it's important to just fight on and live each day to its fullest. Where there's life, there's hope.